name is Jacqueline. I'm a trans woman in Mombasa, here in Mombasa, PEMA-Kenya offices. I've been working on the touch program since it started. We have seen the benefit of this program for our members and ourselves because we have been able to access services to the government hospital where we did not because of stigma and discrimination. Touch program have helped our members, have really educated these health facilities to be able to cope with the issue of MSM, gay people, trans people, intersex and bisexual people in our own community, and to understand the kind of challenges they undergo, and they stop and reduce stigma to these people. Another thing is that touch program have been supporting peer educator in NHF cards, which for a very long time people did not understand. They have seen the benefit of it. We have some of our peer educators who have really benefited from health card, and it's a plus for touch program. It is a pledge that we hope that touch program will continue to support the key population. Thank you so much.
Intersex person, a peer educator from PEMA-Kenya. Ningependelea sana kama touch project ingeendelea kwa sababu mara ya kwanza kabla touch project ikuje nimeona project nyingi sana ambazo haswa zilikuwa hazilengi intersex people and lesbian women. Only a touch project ndio nimeona kwamba involve as intersex people and lesbian women. Before this touch project tulikuwa na challenges nyingi sana. Haswa kwanza ukitaka kuenda kwa zahanati za serikali ambapo ilikuwa ni shida sana kuenda kama intersex person ukitaka huduma za afya. But touch project ilipoletwa sasa niliona iko na umuhimu kwa sababu hata mimi mwenyewe kama intersex person I can freely access the facility without any discrimination and anything to happen bad happening tangu touch project ianze. And kama peer educator research zile ndogo sana nimefanya. Wengi sana nilikuwa na wauliza kuhusu touch project, waliniambia services zake ni tofauti sana na zile services za project nyingine walizokuwa wanazipata kwa sababu ile discrimination ilikuwa kipindi kile before touch project iletwe ilikuwa iko juu sana na ilikuwa ni mingi. But tulipoanza touch project ilipoanza niliona kila kitu kimekuwa sawa na watu wote wana access hizi facilities bila shida na bila challenges zozote. Nimeona project nyingi sana zilikuja na zikaenda ila hazikuwa haswa zinatulenga kabisa. Ningependa iwapo touch project ingeendelea kwa sababu ya benefits zetu sisi kama intersex people and lesbian.
My name is Michael, the program officer from Kenya, and I'm here to talk about the touch project which we have been doing for the last 2 years. It started in May 2017. It's coming to an end in May 2019. But it has been a successful project. The aim of the project was to provide universal healthcare services and coverage to LGBTI persons. LGBTI means lesbian, gay, bisexual, transgender, and intersexual persons. Within those 2 years, we were able to cover and recruit over 4,000 different cohorts for health services, mainly focusing on HIV and STI, which has been a success for us. And also, the project would not have been able to do that without partnership and collaboration with the Mombasa County Health Team. These have enabled our peers to be able to access health services and government-owned health facilities, making it a success. Some of the successes, the few successes that we're able to do is that we're able to reach 4,000 LGBTI persons in Mombasa County. We'll be able to treat almost 550 STI cases. Some of the challenges that we are faced when implementing this project is shortages of lubricants, which is a nationwide crime. There's a shortage of supply of the lubricant in Mombasa, and not only that in Mombasa but also all over the country. But we overcome them by buying lubricants from other sources to ensure that our peers have prevention levels for HIV. This project would not have been possible without the collaboration and the support of the county health team from Mombasa. They have enabled us to form the partnership with 13 health facilities, which have been easily accessible to our peers, to make health services and make health decisions, and those services that are catering for their health. It's a sad that it's coming to an end, but we hope and pray that it is going to be renewed so that the peers that we have recruited will continue having health services.
My name is Ishmael Bahati. I'm the Executive Director of PEMA-Kenya. PEMA-Kenya is an organization that champions for inclusivity of the LGBTI persons in the general population, service uptake, and social spaces. How best can we talk about inclusivity without talking about Touch Project? Touch Project is a project that has seen the inclusivity of LGBTI not only in the service uptake but also participation of the LGBTI persons, a holistic approach to LGBT individuals. So service deliveries, service provision, service linkages to LGBT persons, referral points for LGBT persons. The Touch Project is a project that has seen LGBT persons being trained as peer educators that are LGBTI inclusive, including the I itself, the intersex persons, being included in the project. Something that is very unique, that has never happened in Kenya in terms of health service provision. So the Touch Project has provided a platform whereby we had peer educators being trained from all the spectrum, the clustering of the lesbians, gays, bisexual, transgender, and intersex persons. And so we have peer educators that identify as such. Doing this was not easy. We had our challenges because for one to be trained as a peer educator, you have to have undergone a training by Minister of Health, NASCO. And therefore, the challenge was coming in whereby our LBQ women could not undergo the peer education training because there was no manual to that effect. And therefore, PEMA-Kenya, together with LVCT Health, teamed together to come up with a manual and present it to the government. And luckily, this was accepted by the government and it was used to train the first ever LBQ peer educators in matters to do with HIV interventions. Apart from just LBQ peer educators training, we have also been able to train at least one LBQ person, a lesbian identifying person, to offer HIV testing services. And we have posted the person in a facility whereby our LBQ members frequent. Referral has been easy because there is one of their own who identifies with their problems and their issues in a facility where they can access services. We have been lucky that everyone under the Touch Project has been able to be covered with the NHIF. Have been covered under the Touch Project. So Touch Project has seen everyone receiving stipends from PEMA-Kenya being enrolled on HIF cover. And this has really worked well. We have seen members that have been, we would have used a lot of money if it was not for them being covered under the Touch Project HIF provision. This is not the only achievements that we have achieved. I mean, how can we talk about inclusivity if we want to stand alone? So for this fact, Touch Project has offered integration into the general population, where general population are getting services, be it in terms of health, be it in terms of legal, because Touch Project does not only cover the issues to do with health, it also offers an opportunity to also do advocacy, and that has given us an opportunity to even interact with the police, the county inspectorate, members of county assembly, the county department of health. Those are just the allies and partners that have been able to create in the course of implementing the Touch Project. And this partnership goes a long way because it provides a platform where we can do advocacy and reach out to other people covered in the county of Mombasa. The LGBT persons have always had standalone facilities because of stigma and discrimination associated with the sexual and gender identities that they identify with. Touch Project has taken service providers not only in their department through the impact that discrimination has on HIV prevention and approaches. We have had an opportunity whereby members are able to access these services in facilities that have been sensitized. The service providers are already aware of the needs and issues that surround the LGBTI individuals. It's sad that we have to say goodbye to Touch Project because we have really had a lot of achievements. Police have been sensitized. We have had violent response team linked to the police stations whereby our members, in the event that our members are arrested, the police in those stations have been sensitized and our members who respond to violence are linked to these places. In the police station you'll find a gender-based violence desk. A gender-based violence desk has also been linked to a particular violent response member from the PEMA-Kenya organization. Partnership with LVCT is really something that we are very proud of. We have a lot to count on, and of course it does not come without challenges. Of course, partnership comes with a lot of commitment, and we have seen a lot of capacity building coming from LVCT. So it was not just a partnership of co-hosting or a sub-grant. Went a long way. So we are talking about capacity building for finance person, capacity building for programmers, capacity building on documents that are needed and necessary for the running of an organization and the project as a whole. So thank you very much. It is sad that we have to say goodbye to Touch Project. We will miss Touch Project. However, we have put structures in place to ensure that the work that we are with during the Touch Project is carried forward. So Touch Project might have ended, but the work that came along with that has a long way to go. Thank you very much, and God bless you.